The internet has become a big part of all of our lives today. Our behaviors can be studied through the different types of things we search for on the internet each day. As mentioned in class, the study of this behavior comes from search data. This concept is applied in the article named Internet Searches for Opioids Predict Future Emergency Department Heroin Admissions by explaining how looking at internet searches could help to predict heroin-related admissions. The data would allow researchers and scientists to access and make observations on a variety of different public health problems. I believe this could be especially important in tracking what areas are affected the most from these issues, and provide them the aid and education they may need to overcome the problem.
Upon analyzing models of aggregate search data for each of the 12 opioid terms, the researchers of this study found that across all of the metropolitan cities studied, heroin-related admissions went up from 1,194 per 100,000 people in 2005 to 1,358 in 2011. Minneapolis had the largest yearly increase, while San Francisco had the greatest yearly decrease over the period study. Some of the notable limitations of this research include the fact that Google Trends maintains only normalized search volume rather than raw data of searches, in turn meaning that the context of all searches are lost. Moreover, this study was not able to take into account non-metropolitan cities like rural or suburban areas, thus further limiting the scope of the study to a narrower group of people rather than the nation as a whole. However, the researchers emphasized that they wanted their research to be viewed as a case study, demonstrating the powerful nature of using online API resources such as Google Trends, and with refinement and detailed consideration of biases, future studies such as this one could be conducted and result in more accurate and verifiable data. Looking at how both prescription and non-prescription opioids are leading to overdoses and deaths at such a high rate, I believe it is vital to begin utilizing resources such as Google Trends and other mass data collection services in order to get a grasp on the epidemic in a way that we have struggled to be able to do so as of yet.
Big data aims to improve healthcare by improving electronic medical records and allowing for efficient interpretation of more data. It is now being used for predictive analytics applications, which are now gaining popularity since it forecasts future events in real time. The advantage of this is that hospital staff will be able to make more informed decisions about a patient's care. An example that the article gave for this is clinical staff's ability to decide which patients would have more complications after their operations. Although there are advantages with PA models and its use of artificial intelligence when it comes to collecting large amounts of data, it still hasn't been perfected to do what it was designed to do, which is eliminate uncertainty in hospital care. I personally feel like predictive analytics applications can be used as an additional tool to support decisions regarding patient care. However, I don't think it should be used as the main decision maker because there will always be conflict and challenges with anything that involves technology, and this could negatively affect patient care.
While predictive analytics show great potential in being able to further streamline and improve the process of giving medical care, there are also potential pitfalls. Like many other forms of integrating electronics and digital data into healthcare, there are certain moral and practical concerns which arise. For example, since predictive analytics rely on the compilation of data from many patients, patients who belong to populations that have insufficient sample sizes and therefore possibly inaccurate data are more at risk of getting inaccurate healthcare, which further compounds the problem when their data is added to the larger pool. This could worsen already existing inequality in healthcare for some populations. Another concern is conflict of interest in those who design and apply these analytics, as some may want to skew the data in order to achieve certain effects. Finally, there is an ever-present concern that depending too much on data and analytics may result in healthcare that is more appropriate on average than what a particular patient requires. While predictive analytics certainly shows potential in further improving medical care in the future, I think it will always remain important for healthcare providers to responsibly consider and discuss treatments on a personal level with their patients.